be here and grateful for just you guys being here. Is everyone in here plant-based? Pretty much.
Not
No? Okay. And that's all right, because years ago, when I was growing up, I grew up in a restaurant. My mother had one, and I hated it. It was a meat and three, and I thought, and she was so happy to go to work, and I couldn't understand why. I was like, Mom, how can you like restaurant? Because she worked her tail off. So I worked with her until I was like 18, left home, went to nursing school, moved to New York City because I wanted to get away from McMinnville. And boy, was that a bad decision. But anyway, I'm back, I came back home, finished, went through some more schooling to do other things with phlebotomy and just a lot of little things I wanted to do. And met my husband, and then we had 3 boys, and they're all grown. 2 of them are married, 1 is not. The youngest is 28, and I have 3 beautiful boys and 10 beautiful grandchildren.
Wow, awesome.
So I'm 61 years old, and I feel like I'm 20. I act like I'm 25 sometimes, because I don't feel my age for sure. But that would not have been so if I had not found and been led to the plant-based lifestyle. So in nursing school, you're only taught, I don't know if anybody's in the medical field here, but you're only taught really how to treat symptoms. You're not really taught to look for the cause. Mm-hmm. And so that was just what I did. I worked OBGYN, I worked labor and delivery, I worked ER, I did a lot, and I never, ever, ever thought of food for a patient. I would be like, you want mac and cheese or chicken? That would be, when we would do their lunches and stuff. But moving down the road a little bit, I had a lump in my throat one day, and I couldn't talk I could talk, but it was hoarse. My husband said it was sexy, but I didn't like it. And I'm like, this is not me. And first I thought it was just a sore throat, but I didn't really hurt. It was just a weird feeling. So a couple months went by, and I was like, this is not going away. I started losing weight drastically. I was 5'8", weighed about 120 pounds, and for someone my height, that is very thin. At first I liked the weight loss, but it just kept coming off. I started looking sick. I couldn't get doctors to really help me because all my blood work was fine. And if anybody, again, works medical, you have to go through a series if you have insurance. You have to do each step by step. You just don't go straight to surgery or whatever. So if the first test was good, they wouldn't send me to the next test. So went about 6 months, choking on everything. Then I got to where I felt like I couldn't breathe. And I had a friend that was in radiology, and I asked him, I said, if I come in early tonight, will you just scan my throat real quick? Just real quick. I won't say nothing if you don't. So he did. And he's like, Mary Beth, you have a mass in your throat. And I'm like, what? So immediately, we showed it. We got in trouble because he did do the scan, but the medical field, your family in the medical field, everybody takes care of everybody. And so they moved me forward. I had that removed, and it was cancer. So it was in my thyroid, it was in my parathyroids. I did a little bit of radiation with that and did really well, really good. So when I got home from that, I found out about calcium, how that affects the body when you don't have enough. It's almost like you've had a seizure or you've had a stroke. Your speech is slurred, your movements are slow, you just feel confused all the time. And to this day, I still suffer from that.
What age was that you found this out?
30-ish.
Okay.
30, right around that age. And, I didn't understand what was going on. I was getting confused. My husband thought I was really, really sick, that something else had happened. And then we found out, I had low calcium, I had low potassium, and it was all because they did remove my parathyroids and my thyroid glands, and I just didn't know. And usually they tell you that before you leave the hospital, but I wasn't told. And so I get home, life is going well, and we're getting ready to go to Disney World. And I'm still nursing, and I'm like, I need to go get my tan, because I don't know about any of y'all. I laid in a tanning bed for a long time when I was younger. And I would get in a tanning bed before I went to Florida just so I would have to lay out in the sun while I was there. So I laid in a tanning bed, and I'm sitting there, and I see this place on my chest, and I'm like, what is that? I try to squeeze it, thinking this is it. Sorry, that's probably too graphic if you're eating. But nothing happened. And I'm like, what is this? It didn't hurt. It was fine. I'd had a perfect mammogram 3 months before I found this. So I go to my friend who is a general surgeon, and I said, what do you think? And he said, oh, it looks fine. It's probably just a lung infection. When you come back from your vacation, come back and see me. Anyone in the nursing field or any medical field, we're procrastinators, most of us, because we take care of everybody else. I waited 6 months to go back.
Oh.
And so the only reason I went back was because my left breast was inflamed, huge, and sore, and hurting. And I mean, it was very, very painful. And I go in, and he's like, you know, he shakes his head, immediately sends me to Tennessee Oncology, and have all the procedures done. It is breast cancer. Oh, it's HER2 positive, so you know that is an aggressive breast cancer. And so went through chemotherapy. I couldn't wait to start chemo, guys, because that's just how I was programmed as a nurse, because I thought I'm going to get better, I'm going to take my chemo. Chemo did a number on me.
Mm-hmm.
So I went through 16 treatments. After 16 treatments, I had a heart attack.
Oh.
And so now I suffer from, well, I don't suffer, but I have heart failure. So I was on 3 different medications for heart failure, and now I'm just on 1. So the chemotherapy gave me neuropathy, which was horrible. It gave me GERD, it gave me anxiety, depression. So I was on medications for all of this stuff because of chemo. Every time I go in, they give me pain pills. I got addicted to pain pills. So I was living just numb. And the picture that you see of me for, I don't look like a person that was up here.
Yeah, yes.
I would not let my husband put mirrors up in my house. I said, let's take them down. I can't look at myself. And so he had one in the bathroom so he could shave and brush his teeth. But I could not stand to see myself because I didn't look like a mama. And I was like, I can't stand it.
There you go.
So,
There it is right there.
yeah. So this right here was right toward the end of breast cancer, because they told me like 3 days I would have my portacath taken out if my scans came back good. So after the heart failure, or the heart attack, I remember the night I had it, guys, I never thought about food, ever. I was eating horrible. I was a meat and 3 girl, or 3 meats and a vegetable girl. I loved to eat out. And the best thing that I could really keep down during chemotherapy was a hazelnut latte from Starbucks. And that's, I mean, I loved them, and that's the only thing that could keep me going throughout the day. And little did I know, I was fueling my cancer. I was fueling it. So, and when I get chemo, and nothing against the medical profession at all, because I get it, I was served donuts and Pepsi while I was getting chemo. And now there's a lot of studies where, it does show sugar is the worst thing for cancer. And so is meat, which I found out. So Erlanger did a study on me, because what I'm going to tell you in just a minute, I'll tell you why they did. So there's no cancer in my family. I'm the only person who's ever had cancer and a heart attack. And so I was told, hey, we're going to take your portacath out. And I'm like, okay, yay, because it hurts and I hate it, I just don't want to see it there anymore. And they said, but if your scans are good and your cancer markers are good. So cancer markers are, they check for a protein, and mine were always abnormal, but they were starting to come down, but still abnormal, but not bad. They thought I could do oral chemotherapy instead of do the portacath. So I was doing home health at the time, because I was in extremely poor health, as you could see in that picture. And I got a phone call from the charge nurse, and she's like, Mary Beth, I need you to go see this patient. This lady right here. This was me. Check out the hair. But, so I was like, I'm so sick. I just don't think I can do it. And she said, you're the only nurse we have to go get this assessment done for physical therapy. This woman fell at a Walmart parking lot and broke her shoulder. I'm like, okay, I'll go. So in my medical bag, I would always take a toothbrush, because chemotherapy leaves a horrible, horrible like an aluminum foil taste in your mouth. And to this day, I still get it sometimes. It is horrible. And so I'm in the car. Erlanger, or my doctor, calls, and he's like, Mary Beth, your scans came back and your blood work came back. And I'm like, oh, goody. And he says, and guys, I get emotional. I'm sorry.
It's okay.
Okay, so he said, Mary Beth, your cancer has spread. He said, he said, it's in the left lung, and there's 3 tumors, and we have to leave the portacath, and your cancer markers are high. I'm like, oh crap. So I told him, I said, I'm done. I'm done. I don't care. I'm done. Because I felt like I was dead already, guys. I didn't feel like a person. I couldn't do anything with my family because my immune system was horrible. I wore a mask all the time. And so he said, well, Mary Beth, if you don't do the chemo or some type of treatment, you may not make it a year. We don't know what it is. And I was like, at this point, I don't care. At this point, I know where I'll go if I don't survive. I'll still be a winner. And so he was so good. He said, well, call me after you tell your husband. And I was like, okay. So I still have to go see this patient. And I hang up with him, and I knock on the door. I said a little prayer in the car. I was like, Lord, just please let my family understand my decision. Do not let them pressure me. Give them peace about my decision. And so I used to work oncology occasionally, and I would never understand why people gave up. At that moment I did. I was like, this is why, because you don't feel like a person anymore. And, you know, I saw my family going through it, and that's what gets me. So let's do jumping jacks. So anyway, I knock on the door, and this woman comes to the door, and I'm looking at her, and I'm like, I got her chart. I'm like, I'm here to see so and so, and she's like, no. I asked her. I said, I'm here to see your mother, and she goes, I'm her, and I'm like, I'm looking, and I'm thinking she's messing with me, and so I was like, so what's your social security number? And so she tells me, and then I'm like, what's your date of birth? And she tells me, and then so we just kind of laugh, and I go in. I'm still just staring at her, probably inappropriately, because I couldn't get over her skin. Her skin was absolutely beautiful. She was 80-ish, and she looked, and this picture you saw of her up here, she's 93. So that's an old picture of her. But I was just so amazed with her skin, couldn't get over it. And so when I did her assessment, I had to see everything from waist up. I couldn't believe it. I was like, wow, everything was flawless. It was just crazy. And so after her assessment, did all her work, and I said, I'm gonna ask you probably a personal question, but who's your surgeon? And you know, and she cracked up and she goes, what? I said, what's your secret to this beautiful skin? And she said, well, honey, if I tell you, you'll think I'm crazy. And I was like, no, I won't. And so she hands me a DVD, and the DVD is in a little cardboard cover, and I didn't know what it was. I thought it was beauty cream, I'm not gonna lie. So I'm thinking, I'm going home, I'm gonna order it, I'm gonna be on auto ship. You know. And so, anyway, I get home, and all the way home I'm crying, because I think I gotta tell my husband this news, you know, and tell him what I decided to do. But in a weird way, I had peace over it. I just felt good about it. So I get home, I tell him, we have our cry, and then I'm like, oh, by the way, can we watch this? And
There she is, plant-based.
yeah, this is her at 93.
Wow.
Yeah, and she's older than that now.
She's still alive?
She's still alive, and she comes to my cafe.
Wow.
Yeah. So, so anyway, we watched the DVD, which is kind of like Forks Over Knives, but it was before Forks Over Knives. It's called Eating, the third edition, and it's very old, but it has the same doctors in this DVD or documentary, and I don't know, it just clicked. It clicked. I thought, this is a godsend. This is divine intervention. And I told my husband, I said, we got to try this. So I called my doctor, like I said I would, and I said, look, I'm going to go plant-based. And he didn't laugh, but I could tell he wanted to. And he's like, Mary Beth. And I said, you said a year. Give me 6 months. Let me see what happens. And if my markers don't get better, I'll go back. I'll do your plan. So trust me, in a small town going plant-based, because I didn't know where to start. I didn't realize you just go to the produce department, basically. You just go to the produce, get you some beans and corn and squash and cabbage and all that, but it took me a minute. So I juiced, I fell in love with juicing, watched a documentary about juicing, started juicing, eating whole food plant-based. I didn't eat anything processed, hardly anything cooked. Mainly everything was raw for a year. Well, did it for 6 months. Went to the doctor, and he come back in there and he says, well, your blood work is about the same, but your skin looks better. And I'm like, okay, so what's that mean? Are we good? And he's like, yeah. And so so I said, okay, I'm gonna do it 6 more months, and if it gets worse again, same thing. He's like, all right, and he was great. And so just a little side note here, I used to make fun of this lifestyle. I thought people that ate like this were weird, and now I'm a weirdo. But it's a good thing. So my daughter-in-law is from Oregon, one of them, and she would call me every day when I was sick, and she'd say, Mary Beth, if you don't change your diet, you're going to die. I would get mad. I would literally get mad at her. She would send me cookbooks in the mail. I'd want to put return to sender because I didn't get it. And I deal a lot with that with families now. I help a lot of families that are going through the same thing that I went through. And the patients, you know, they want to go this way, but the family is kind of pushing, like, because they need the protein. And I'm like, let me tell you about protein. Let me tell you, you know, some different ideas. But that's what I do now. I do a lot of counseling for cancer patients, and it's free. I don't charge anything because I feel like when you're going through that, you don't have a lot of finance. I know I didn't because I couldn't work. But, so, went home, I watched the documentary Fat, Sick, and Nearly Dead with Joe Cross. Has anybody seen that?
I actually met him. He did a presentation
Okay.
where I worked at one point.
Well, he's a good friend of mine. Y'all need a discount on a juice, so you let me know. But I knew him before he got like he is now.
Yes.
And so I'll tell you about that in a minute, but you know, I watched this, I was like, oh my gosh, I gotta really bump up the juicing. And so I did, and then 6 months down the road, I went in for my appointment, did my PET scan, the cancer markers, and I had 3 doctors that come in at once, and I'm thinking, oh, it's bad. And my main doctor is crying. And I could tell, you know, he was shaky, and I'm like, oh Lord. And he said, Mary Beth, he goes, he said, I don't know how to even explain this. He said, but your cancer markers in your blood are normal and really, really good. He said, and I don't see any cancer in your scans. He said, I can't believe it. And he just starts sobbing. Then we all start sobbing. And then instead of ringing the bell, we just run through the halls. And I know people thought I was crazy, but I was so grateful and so blessed that God gave me a second chance. It's like, you know, I know he doesn't, you know, I don't know why he let me stay here, and thank goodness that he did, but I'm so grateful for it, and I'm going to be the vessel that if he wants to use me, use me. And that's why I try to reach as many people as I can. And so, with that being said, a lot of stuff happened after that. So I fell in love with plant-based, couldn't turn it off. I was chasing people down in Walmart trying to change their lives. Surprised I didn't get arrested, because I told my husband, I said, there's not many people at Walmart when I go in. There's cars there when I get there. And he said, well, they probably get on the PA and be like, ladies and gentlemen, get your photo out. She's in the parking lot. She's in the parking lot, get out. But, so I learned how to kind of step back. And I did go back to school and get certified in some things, and so that people would kind of listen to me if they wanted, you know, are interested. It was hard not to be pushy, but when you're pushy, people run. Just like I did with my daughter-in-law. When she was pushing me, I would run. And when I saw my patient that had this result, that was proof in the pudding for me. And I was doing it out of vainness because I thought my skin was going to look great. But little did I know what it was going to do for me and my family. So, like I said, I chased everybody down. And once I got past that and past the pushiness, I started taking fresh food, like you see here, with juice to cancer patients in my hometown at Minville. And so I would show up with this big jar of green juice, and I'd get funny looks, but it was people that I knew that was dealing with cancer. And they would look at me funny, but the next day they would call me and they'd be like, Mary Beth, that was absolutely amazing and I felt great. Can you bring me more? And so I brought more. And then I started, every time there was a county fair, I was serving free food at the fair because I'm like, I didn't say don't eat that food, but I was like, just try this, you know. So it started getting really big of what I did in the neighborhood because everybody saw me at death's door and they saw the transformation over a year. So it was believable. And so that's kind of how that's kind of how I've been successful, is just from my community alone. And so I started doing farmers markets, and there would be a line. It just would, and all I had was a little home juicer. I had 3 of them. I was trying so hard, trying to get the juice out, and people would be, you know, it was wonderful to see. Like I would be so happy. I'd be like, oh girl, just one more minute, you know. and it just became, I don't know, I just got on fire with it. And so somebody said, maybe you need to open up a brick and mortar. You need to get a restaurant. And I was like, oh, I don't know about that. Because my mother had one, and I had a bad experience with that. So my mother and father were tragically killed together. And so years ago when I was younger. And so I was like, man, Mom was probably up there like, you don't get a restaurant, girl. So I opened up a restaurant. I had 2 items. I had a cooler, an Igloo cooler, Tupperware, and a couch. That's all I had, because I didn't want to borrow any money. And it worked. Within 5 months, I had enough to buy tables. I picked a few out of the dumpster, I'm not gonna lie. And but they cleaned up really well. And did some yard selling, and before I knew it, my little cafe was put together. And people that's been there, you can see that it does, nothing matches, but it goes together.
Yeah,
It's
it
crazy.
does.
So everything has a story behind it. We got rid of some of them because they kind of fell apart, but we used to have happiness tables or just thankful tables, and you would write I still keep them, they're in storage, but the messages that people would leave, they would write like what they were grateful for or their experience at Juicy's. And so, I don't know, it's just been like a little heaven to me there, just because I'm like, to me that is, because I'm happy there and I love talking about it. So then word got out in other communities what we did. And so we grew 2 other restaurants, and then COVID hit in Murfreesboro, and I ended up closing after 5 years, which was actually a blessing in disguise for me because I was so stressed out. And the doctor said, if you don't slow down, you're going to be back in the same boat you were in. Okay. I never saw my family either, ever. I was open to close every day, 7 days a week. And the one in Cookville, I sold that one. And so I just have the one in McMinnville now, the original. And so then Channel 5 had reached out to me and asked me to do a segment. And I was, okay, what? Okay. So it was 4-minute segments. I had to do a recipe. Well, then they asked me to come back, and then I've been going back for every month for 3 years now. So if you need a recipe, go to Channel 5, go top of the town section, search my name, and all my recipes will come up. There's a bunch. So we're getting ready to air a Christmas special, so I'll have Christmas recipes or holiday recipes on there too. I think I'm doing cookies in a week or so on there. So be watching. I'll show you how to make some cookies. So, and then of course me and Joe, I reached out to his company and I said, thank you so much for making this documentary. It's really taught me a lot about juicing. This is Joe. And he's from Australia. And any of you that have not seen the documentary, he was also a sick person. And he came to America and did a 90-day juice fast. And so he documented it. And I was so blown away with his results. That's why I wanted to try just to go heavier with it. I was already doing it, but his story inspired me to go a little bit more. And he goes, well, we're doing another documentary. Would love to have you in it. And I was like, ooh.